At Grant, we perform different types of robotic surgery. The main one in men is called a robotic-assisted prostatectomy. Additionally, we can perform surgeries for kidney cancer, such as partial nephrectomies or complete radical nephrectomies. And we also have the ability to perform cystectomies, either partial or complete cystectomies for bladder cancer. The Da Vinci system was invented by Intuitive Surgical Systems. The way we've adopted this system in the United States is because the arms that are on the robot work differently than a regular laparoscopic instrument. The normal laparoscopic instrument just opens and closes in one plane only. With the robotic system, anything that my wrist will do, the endo-wrist instruments will do. So as I flex like this in the robotic console, I make the robotic instruments do this as well. That gives me the full 7 degrees of rotation to do operations that are very meticulous, especially as we go around curves of an organ or try to sew intercorporally inside someone's abdomen. The benefit of robotic-assisted surgery to the patient is that from the surgeon standpoint, he's able to do a very complex operation easier. And it also magnifies the surgeon's vision 10 times over normal. So we're able to find items easier and coagulate blood vessels before they start to bleed. Thus, the benefit of blood loss is usually 10% over a normal standard open operation.
What brought me to surgery was a positive test for prostate cancer. And as a result, I was sent to Dr. Brown.
If a patient is found to have prostate cancer, robotic surgery should be one of the things they consider. If they're considering an open operation, they must keep in mind that 85% of all people have their prostates removed robotically versus open. The traditional patient is someone that has a smaller gland prostate, usually less than 60 grams, which is about the size of 3 walnuts. They also usually have a PSA under 10 on average.
I was sent to Dr. Brown through my family doctor because he noticed my PSA number was high. My main concern about the prostate surgery was how long the recovery time would be.
Patients traditionally would like to know when they have robotic surgery, how does this compare to an open operation? I remind them it is still an operation, but it is a minimally invasive procedure. Thus, you will still have some of the same risk and complications as having a big open incision, but we're using 3 to 5 small holes the size of my finger to do the operation. Thus, you have less pain, less use of pain medication, quicker return to activity. With the open operations such as the prostate, a patient's usually in the hospital 2, maybe 3 days. With the robot, they're in the hospital usually 23 hours.
Well, after surgery, the recovery time was quick. I was able to get up that same day, and I was back to work within a month. My pain recovery at home was non-existent. I didn't need to take anything, and I was very pleased with my recovery time.